It was about 1 month ago that I made my last video before buccal fat pad removal, talking about my thoughts going into the procedure, and about 2 weeks ago that I sort of showed off my initial results and experience. The incision's only this long. It does feel like a major wound. Now that we're approaching 1 month after surgery, I want to take this opportunity to discuss my experience so far. Hi everybody, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon in Newport Beach, California, but I'm also a patient because I myself had buccal fat pad removal, not to dispel any myths of it making me look gaunt or anything like that, but really because I was bothered by bulges and fullness in the anterior half of the lower third of my face. It's something that really bothered me for some time, and I finally found somebody that I trusted to perform the procedure.
Thank you so much. It makes it a little easier.
But I've actually learned so much from the procedure, and the results are so great, and I want to talk about it today. So the first thing is, as being a patient, I realized the importance of communication in the OR, and I did discuss this in my past video. What I really also learned is that these small intraoral incisions are not as small and like inconsequential as I once thought. As a surgeon who performs a lot of facial implant surgery and facial trauma surgery, it almost seems like the inside of the mouth, when you close it, it's almost like free scars. It's free for the taking. Nobody's gonna see them. You don't feel them. You can't even see them once they heal. They are very forgiving. If they split open, they usually just heal on their own within a week or two. But the truth is, even a 1 centimeter scar, especially on the left side of my mouth, it was really uncomfortable for a long time, and I felt like I really had to protect it. I didn't even like feeling the stitches that were in there. And at 2 weeks, I started to look normal enough that I can go out in society and nobody knew I had anything done. But now at a month, I'm starting to really like how the results are turning out. If you'll recall, I had 1 cc of fat taken out of the left side of my face and 2 cc's of fat out of the right side of my face. And on one hand, that's a lot less than the average amount, but that's truly all that my surgeon could find. And when I reviewed the footage of the video, I saw that that was truly it. And you know, one of my big mantras with buccal fat pad removal is that it's not the size that counts. And I couldn't be a better example of that. My nurse also had only about 2 cc's of buccal fat per side. Her result was also very good. So the point is, size truly doesn't matter. It's the configuration of the buccal fat pad in your face and other features like skin thickness and other things like that, bone structure, and we can go on and on. The other thing I'm noticing at 1 month is that I feel sort of a funny thickened scar on the left side of my inner cheek. That was the harder side. That was the side that took longer and less fat came out of. And I think the additional trauma to that site did make the scar a little bit more nodular, a little bit knobby. You can't see it, but you can certainly feel it. I can feel it with my tongue. And what I've been doing over the past few weeks is really trying to massage it. I feel that my cheek muscle tone hasn't quite come back. And so when I eat, certain foods or I say certain things, I do feel slight abnormalities on the left side of my cheek muscle. And this is something I never would have noticed by examining a patient. So being a patient myself says a few things. Number 1, size doesn't matter. Number 2, the scars, even though they are like, on the grand scheme of things, relatively inconsequential and forgiving, are still kind of a pain in the ass to deal with in the post-operative period. And third of all, I really do believe in this procedure. I know a lot of people see online that it makes you look gaunt and things like that. I kind of have a gaunt face to begin with. My BMI is not as low as it was, and you guys have seen Ozempic videos of mine when I even lost more weight. I became gaunt with weight loss. Buccal fat pad removal has only restored a nice contour in my midface. And if you look at these before and afters in 2 dimensions and 3 dimensions, you'll see that there is a small but meaningful result that even if it doesn't look that huge on a camera before and after, I see the difference, and that's what really counts. I love the way this has changed my face, albeit subtle. It hasn't changed my appearance. People were worried about, you look great, why would you do anything to your face? But I see a difference in the mirror, and I want to convey my experience and share it with you. Thank you so much for taking the time to watch this video.